Next, I would perform the breast exam. So for the breast exam, I would first assess breast size and symmetry. I would then assess for dimpling. So I would assess 3 different positions for dimpling. So I would assess with the arms at the side, arms at the hips, and arms above, and to assess for any dimpling. Next, on the the breast exam, I would palpate. So I would palpate all quadrants of the breast. I would palpate the tail of Spence, and I would palpate the nipple, looking for any lumps or masses or abnormality of the breast. Doing the palpation, I would have the patient lay underneath a pillow, underneath their scapula, with their arm in the air. I would then demonstrate and discuss how to perform a self-breast exam yourself. So you should perform a self-breast exam monthly, and roughly 1 week after your period, you would perform the self-breast exam. You could perform it in the shower. You could also perform it in front of a mirror or laying down. And again, you would palpate all quadrants, the tail of Spence and the nipple, and palpate and examine for any dimpling or lumps in the breast. Next, I will go ahead and have you lay down for me here, please. And I will cover your legs up. That's fine. And what I'll do here is I'm just going to kind of roll the shirt up a little bit here. And first, I'm just going to look at the chest. So first, I'm just looking at the patient's skin on the chest. I'm seeing a moderate amount of chest hair that's evenly distributed. The chest skin appears to be tan, and color is consistent throughout. Just slightly touching the chest, it appears to be warm. The warmth is consistent throughout. I'm seeing symmetrical chest rise and fall. I'm not noticing any retractions or bulges. The patient is breathing with little effort, and the rhythm is regular. After assessing the chest here, I'm now going to go ahead and listen to 8 areas of the lungs to assess the upper, middle, and lower lobes. Just gonna have you take a big breath. Actually, I'm gonna have you take a big breath in for me, and out. Big breath in through your mouth, and out. Again. Couple more for me. All 8 lung sounds are clear. I'll leave it here. All 8 lung sounds are clear. I'm not hearing any adventitious lung sounds. Next, I'm going to go ahead and assess the heart here. So I'm looking, just inspecting the heart. I'm not seeing any pulsations. I'm now just going to go ahead and palpate your heart here. So I'm palpating. I'm not feeling any lifts, heaves, thrills, or any pulsations. I'm now going to go ahead and palpate the point of maximum impulse, the PMI. The PMI is smooth. It's about a 2+ amplitude with a regular rate and rhythm. Next, I'm going to go ahead and listen to the heart. So there are 5 spots of the heart that I'm going to go ahead and auscultate with. First, I'm going to auscultate with the diaphragm, and then I will auscultate with the bell for any bruise as well. So first, I'll auscultate the aortic area, which is the 2nd intercostal space, right sternal border. I'll then auscultate the pulmonic, which is the 2nd intercostal space, left sternal border. Then auscultate Erb's point, which is the 3rd intercostal space, left sternal border. I'll then auscultate the tricuspid, which is the 4th intercostal space, right sternal border. And lastly, I will auscultate the mitral area, which is your fifth intercostal space, the left mid-clavicular line, and I will auscultate here the apical pulse for 1 minute. Now, if you're auscultating for 1 minute, the patient's heart rate is roughly about 74 beats per minute, and it was a regular rate and rhythm. I'm now going to go ahead and auscultate with the bell and listen for any bruits or murmurs here. So again, I'll listen to your aortic area, which is the second intercostal space, right sternal border. I'll then listen to the pulmonic, second intercostal space, left sternal border, the herbs, which is the third intercostal space, left sternal border, tricuspid, which is the fourth intercostal space, left sternal border, and the mitral again. And no bruits or murmurs were heard in those 5 areas. Next, I'm going to go ahead and I'm going to start to assess your abdomen here. So what I'll do is I'm just going to pull your shirt down a little bit, and then I'll have you just kind of flex your knees up. Your knees just a little bit. Yep, perfect right there. And I'll pull your shirt up and just, first I'm just going to inspect the abdomen here. So inspecting first the skin color appears tan and evenly distributed throughout in accordance with the rest of the body. I'm not noticing any excessive hair growth. The skin appears intact. I'm not seeing any masses or lesions or cuts. I'm looking at movement of the belly. I'm not seeing any peristalsis or any pulsations. Assessing the contour here, the belly appears to be flat, slightly rounded. Next, I will go ahead and listen to your abdomen here, auscultate your abdomen in all 4 quadrants. You can flex them out a little bit for me, just a little bit. Thank you. Bowel sounds were audible. Patient had normal active bowel sounds in all 4 quadrants. Next, I will go ahead and listen for any bruits. So we've got a couple different areas we'll listen to here. First, we're going to listen to the aortic area. No bruits are noted. We'll now listen to the left renal and the right renal. And then we'll listen to the right femoral. And the left femoral. No bruits were noted in the aortic, renal, or femoral arteries. Next, we're going to go ahead and percuss your abdomen here. So again, kind of like how I percussed your back, I'll just lightly place my hand there and lightly percuss your abdomen here. And we'll do that in all 4 quadrants here. Noticing tympany in all 4 quadrants of the abdomen. After percussion, I'm now going to go ahead and palpate your abdomen. So first, I'm going to just do a light palpation on all 4 quadrants of your abdomen. Let me know if you have any tenderness, okay?
Okay.
Alrighty. Can Can you flex your knees? Just lower your knees a little bit for me, please. Thank you. Noticing any tenderness?
Nope.
No tenderness noted on light palpation. I'm now going to go ahead and do a deep palpation of all 4 quadrants. And again, let me know if you have any tenderness, and I'm going to be primarily doing the deep palpation to assess for any masses here. No masses were noted. Did you have any pain?
No.
No pain noted as well. Next, I'm going to go ahead and test for rebound tenderness. So I'm going to press in on your abdomen and let go. Let me know if you have any tenderness or pain. You're okay?
No.
Any pain noted? No pain noted as well. That's great. Next, I'm going to palpate your right costal margin, see if I can palpate your liver here, okay? So what I'm going to do is I'm going to kind of place my right hand kind of behind your back, near your hip area. I'm going to use my left hand. I'm going to have you breathe in, and as you're breathing in, I'll palpate and try to palpate your liver, okay? All right, here we go. Take a big breath in for me. Nope, just breathe in and hold it. Okay, you can breathe out. The liver was not palpable. Next, I will go ahead and palpate the aortic area to see, palpate for any pulsations here. And the aorta is not palpable. I'll go ahead now and palpate femoral pulses. So we'll palpate the femoral pulses bilaterally here. And the femoral pulses are about a 2+ in amplitude with a regular rate and rhythm. Next, I will go ahead and I'm going to assess for a hernia here. So I can roll your shirt back down. I'll have you just lay your legs flat for me. And then what I'm going to have you do is just bring your head up for me. No hernia is noted. You can bring your head back down. Did you have any pain when you did that?
No.
And no pain noted as well. No hernia is identified. Next, I'm going to go ahead and move down to your lower extremities. So I'm going to pull your shirt back down for you here, and I will uncover your legs here and look here at your lower extremities. So first, I'm just going to assess the lower extremities for the skin. Looking at the skin here, moderate amount of hair that appears evenly distributed throughout. I'm not noticing any cuts, wounds, bruises, any masses on the legs here. I'm just going to go ahead and palpate the legs for temperature here. The legs are warm with even temperature throughout. Next, I'm going to go ahead and palpate your legs here. So I'm going to palpate for your bony prominences for any edema here. So palpating the bony prominences. I'm not noticing any edema noted. Are you having any pain when I palpate here?
Nope.
Alrighty. Next, I'm just going to kind of look at the legs. I'm not seeing any varicosities, any varicose veins upon inspection as well. Next, I'm going to go ahead and test the patient's pulses. I'm just going to have you sit up a little bit for me here so I can get you in the view of the camera. That's fine, yes. And I will palpate your posterior tibial pulses. And the pulses are about a 2+ amplitude with a regular rate and rhythm. I'll then go ahead and palpate your dorsalis pedis pulses with a 2+ amplitude with a regular rate and rhythm. And I'm just going to go ahead and assess your feet here. So just kind of looking at the feet, I'm not seeing any abnormalities. I'm not seeing any ulcerations, cuts, or wounds. The nail beds appear clean with about a 160-degree angle. And I'm going to go ahead and assess for cap refill here. And cap refill is less than 2 seconds on all toes. Lastly, I will discuss the testicular exam. So I would be performing a testicular exam. First, I would just examine the penis and the scrotum, and I would assess for any hair distribution and skin abnormalities. So I'd be looking for abnormal hair, skin cuts, any discoloration or abnormalities with the skin. I would then palpate the penis. I would palpate for tenderness. I would palpate for any masses as well. After palpating the penis, I would then look at the ureteral medius and look for location and see if there's any abnormal discharge. After examining for any discharge, I would then palpate the testes, the epididymis, and the vas deferens. And again, I would palpate for location, size, and tenderness, as well as any masses there. And then lastly, I would discuss a testicular exam, which should be performed monthly. It can be performed in the shower. It can be performed in front of a mirror. And again, you should use inspection to inspect for any hair distribution, any abnormal skin discoloration or skin abnormalities, as well as palpating for any tenderness or masses. And that is going to conclude the physical assessment. Thank you very much.